Good day, my name is Meng Febunayog, BSN-II at Mate Doctors College, and today's video I'm going to discuss about the penicillin, penicillin G sodium. Penicillin sodium, the classification of penicillin sodium is the sodium salt form of benzyl penicillin, a semi-synthetic broad-spectrum penicillin antibiotic with bactericidal activity. And the actions is penicillin G sodium is a fast-acting antibiotic that fights bacteria in your body. Penicillin G sodium is used to treat many different types of severe infections, including strep infections, meningitis, anthrax, pneumonia, gonorrhea, and syphilis. The dosage of penicillin G sodium is adults and teenagers is 20 million units per day in divided doses IM or IV every 4 to 6 hours for 10 to 12 days. The indications is for CRCI is less than 10 ml per minute. Give the full loading dose followed by 50% of loading dose every 8 to 10 hours. If patient is uremic and CRCI is more than 10 ml per minute, give full loading dose. Then give half the loading dose every 4 to 5 hours. For additional doses, make additional dosage adjustments in patients with hepatic disease and renal impairment. The contraindications is contraindicated in patients hypersensitive to drug or other penicillins, and in those on sodium restricted diets. Drug may cause CD/AD ranging in severity from mild diarrhea to fatal colitis. If CD/AD is suspected or confirmed, drug may need to be discontinued and treatment initiated. Use continuously in patient with other drug allergies, especially to cephalosporins, because of possible cross sensitivity. About the adverse reactions, CNS is neuropathy, seizures, seizures, agitation, anxiety, confusion, depression, dizziness, fatigue, hallucinations, and lethargy. CV is for HF, thrombophlebitis, thrombophlebitis, GI, enterocolitis, ischemic colitis, nausea, vomiting, pseudomembranous colitis. And GI is enterocolitis, ischemic colitis, nausea, vomiting, pseudomembranous colitis. GU is nephropathy, interstitial nephritis, hematologic is hemolytic anemia, agranulocytosis, leukopenia, thrombocytopenia, anemia, eosinophilia, musculoskeletal is arthralgia, and the nursing considerations is: first is drug may alter normal colon flora, monitor patient for diarrhea, and initiate therapeutic measures as needed. Drug may need to be stopped. Second is observe patient closely with large doses and prolonged therapy. Bacterial by IV or fungal superinfection may occur, especially in elderly, debilitated or immunosuppressed patients. Third is antibiotic use can cause overgrowth or non-susceptible organisms or superinfection. Monitor patient for infection. Third is don't confuse penicillin G sodium with penicillin, penicillamine, or the other types of penicillin. For most hypersensitivity, for most acute infections, continue treatment for at least 48 to 72 hours after patient becomes asymptomatic. Maintain antibiotic therapy for group A beta hemolytic, streptococcal infections for at least 10 days to reduce risk of rheumatic fever. 6. The last one is give high doses or above 10 million units 10 million units by intravenous slowly because of the potential adverse effects of electrolyte imbalance from the sodium content, which is 1.68 milliequivalent of sodium per million units for million units. That's all. That's all for my video reporting today.